Hello everyone, I am Mihriye Mete. Today I will present you the results of our study on gender differences in burnout among general surgeons. The study is titled Burnout or Professional Fulfillment, Understanding the Wellbeing Gender Gap in General Surgeons. As you can see, this is a collaborative project that involves multiple colleagues from the PIVA community that I'm privileged to be working with. Our primary objective in this study was to present a conceptual framework that attempts to address the underlying causes of the burnout gap between female and male surgeons. So to that end, I will talk about background a little bit and then talk about methods. I will describe the results and then we'll do the conclusion and discussion. Multiple studies have demonstrated that burnout is higher among female physicians compared to male physicians, but we don't have a very good understanding of this difference in burnout. So the so-called gender gap in burnout begins in medical school and persists throughout physicians' careers. There are multiple explanations for this observed difference between male and female surgeons. This is the list of potential explanations that applies to surgery, but I think they equally apply to male and physicians in general. So we can say that female surgeons continue to experience professional barriers such as gender discrimination, disparities in pay and other resources, identity-based mistreatment, more harassment and discrimination if they are from a sexual, racial, or ethnic minority, and disparities in salaries partly due to lower starting salaries. Furthermore, compared to male counterparts, female physicians are more likely to care for patients with more complex psychosocial problems. Female physicians spend more time with patients and engage in more patient-centered communication. Female physicians allocate more time to comprehensive review of medical information. We can also address their general stress and anxiety levels. Female physicians are reported to have significantly higher levels of stress and anxiety. They adopt different coping strategies. They are more likely to have sleep deprivation. And also there are different social expectations and resources for women who are balancing work and life. So the studies show that even after controlling for work hours, age, and specialty, female physicians spend more time on household responsibilities, and they also spend more time on childcare. So how do these factors interact and jointly make female physicians feel more burned out than male physicians? We hypothesize that the gender-based differences in professional and personal lives of female physicians contribute to the difference in burnout levels through two constructs. One is professional fulfillment, and two is control over schedule. We tested this hypothesis that the difference in burnout between male and female surgeons would be mediated through professional fulfillment and control over schedule. So we tested these hypotheses by focusing on one of the specialties with high risk for burnout, which is general surgery. Our study was based on a sample of 431 general surgeons who participated in the Physician Wellness Academic Consortium standardized electronic well-being survey administered to 11 institutions nationally. This is PWAC 1.0. Data were summarized using descriptive statistics by varied associations were tested using t-test and then chi-square test. So we first conducted multiple variable linear regression analysis to determine the extent of the gender gap in physician burnout and to show what happens to the effect of gender on burnout if we control for sleep impairment, control over schedule, and professional fulfillment. And next, we specified a structural equation model, like a mediation analysis, and to estimate the mediating role of professional fulfillment and control over schedule in the relationship between gender and burnout. The first set of results presented on the slide are about the two sample comparisons of burnout score professional fulfillment, sleep impairment, and control over schedule variables between male and female general surgeons. The statistics here were conducted using two sample t-tests for continuous variables and then chi-square for categorical variables. We rescaled the continuous measurements to be between 0 and 10. You can see from this table that the burnout score for female physicians is significantly higher compared to male general surgeons. It's 3 versus 2.5. And percentage-wise, 46% of female surgeons are in the burnout category versus 33% of male surgeons are in the burnout category. And this difference is highly significant. For professional fulfillment score, again, professional fulfillment is significantly higher among male surgeons as we expected. And while 56% of male surgeons have professional fulfillment present, only 37% of female surgeons endorse professional fulfillment in this sample. There was no significant difference between male and female surgeons in terms of sleep-related impairment, so they're pretty close, 45% to 41%. The difference is not significant. And control over schedule, again, as we expected, male surgeons have a more feel like they have more control over their schedule compared to female physicians. So male surgeons mean control over schedule score was 5 and female score was 4.2, and this difference was highly significant. So I think I forgot to mention that 64% of the sample was male and 36 was female. Next, we wanted to see if gender was independently related to burnout. In other words, what happens to the effect of gender on burnout if we control for professional fulfillment and control over schedule variables. So in this linear regression model, then the outcome score burnout is regressed on gender, sleep-related impairment, control over schedule, and professional fulfillment score. This is a very well-performing model. The R-squared is 0.59. The fit is strong. So we see that the female difference here disappears. The p-value is 0.93. So there's no more gender gap in terms of burnout in this model. Sleep-related impairment has a huge effect, as we all know that it is the case. If for physicians or for surgeons who have sleep-related impairment, the burnout score was on average 1.5 units higher. Control over schedule similarly has a large effect, and as control over schedule increases by 1 unit, the burnout score decreases by 0.14 unit. Again, professional fulfillment is strongly related to burnout. As we all know, that is the case. And as the fulfillment score increases by 1 unit, burnout score decreases by almost half a unit. So here we know that actually the results are telling us that gender is not independently related to burnout score, but it is related to professional fulfillment and control over schedule because the effect disappears when we control for those confounders in the same model. So based on the linear regression model, we can say that the sex of the surgeon is sort of irrelevant to burnout, right? Statistically speaking, of course. And we know from the other set of results too that females have lower professional fulfillment and they have lower sense of control over their schedule, but also professional fulfillment is associated with burnout, and then control over schedule is also associated with burnout score. So since this gender gap disappears when we control for these variables, then we know that statistically control over schedule and professional fulfillment are also related to gender. So, which suggests that professional fulfillment and control over schedule can be used as mechanism to explain how we or why we see these gender differences in burnouts. In other words, the hypothesis becomes that it's not that females are more likely to be burnout or they have higher burnout. It's that they suffer from higher burnout because they are less professionally fulfilled and they have less control over their schedule. To test this hypothesis, then we just specified a mediation model in this data. So this is a model where we have two mediators, and we also controlled for sleep-related impairment in the model. The results suggest that really the professional fulfillment and control over schedule are two strong mediators of the relationship between gender and burnout score. So the indirect effect of or the indirect effect through professional fulfillment actually constitutes 79% of the total effect, and the indirect effect through control over schedule constitutes 21% of the total effect. So the gender total effect of gender or direct effect of gender is not there anymore when we allow these mediation node relationships. Okay, what are our conclusions? One is that the prevalence of burnout is significantly higher among female surgeons compared to male general surgeons based on this data set. Female surgeons feel having significantly less control over their schedule. They have significantly lower levels of professional fulfillment. But gender is not an independent predictor of burnout when we control for professional fulfillment and control over schedule. On the other hand, sleep-related impairment, professional fulfillment, and control over schedule are strong predictors of burnout. So a mediation model that places professional fulfillment and control over schedule in the pathway between gender and burnout allows us to conclude that gender gap in burnout is totally mediated by professional fulfillment and control over schedule variables. Therefore, our results provide statistical evidence to suggest that female surgeons feel increased burnout because they are less professionally fulfilled and they have less control over their schedule. Overall, our results suggest that we can address higher burnout among female physicians by devising organizational and educational strategies that may make scheduling more flexible for female physicians, and also by trying to better understand the components of professional fulfillment and then finding those components that may be more harmonious with female physicians' professional priorities. This concludes our presentation. I thank you very much for listening to this presentation. I look forward to your questions now. Thank you.